professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, everyone. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, what I'll be covering more so than is the effect of antimicrobial resistance on chronic diseases. So I've been talking chronic disease, how to study chronic diseases in terms of the specific epidemiological conditions. And now I'm more focused on talking about some of the factors that affect specifically chronic conditions. And surprisingly, most people would not make the connection, of course, between chronic diseases and infectious diseases, but surprisingly, infectious diseases do play a major role in how chronic conditions occur. And you can see this in ICU patients if you have treated patients before, which I have in the ICU, and you see that there are microbial and and non-communicable diseases to be concerned about. So looking at this matrix, I'm going to open this in a new tab just so that we can take a look at this whole thing a little bit more closely. But what we're seeing here is mortality, is the risk of mortality, the health outcomes, so what those are, and things like that. So it's the overall strength of evidence across conditions and the impacts. That's what this is. And so, in terms of diabetes and mortality, there's a weak sort of correlation, strong correlation with health outcomes. But I think the final column is the most important to pay attention to, is the risk of antimicrobial resistance. In cancer, there's weak, but in diabetes, moderate, strong. You have an immune system that's somewhat compromised, so it makes sense. In the ICU, of course, moderate. So anyway, so this is a good one to take a look at, just for starters. But this is actually a systematic review that was conducted on antimicrobial resistance. So there are specific facets to be thinking about. But the title, usually I start with the title, but the title was A Rapid Evidence Assessment Exploring Whether Antimicrobial Resistance Complicates Non-Infectious Health Conditions in Healthcare Services. And of course, the conclusion was yes, it definitely does, unquestionably. The evidence showed that for all health conditions and healthcare service areas reviewed, at least one study demonstrated a higher risk of death for patients with resistant infections compared with no or drug susceptible infections. Poor health outcomes were also associated with resistant infections in some instances, such as severe sepsis and failure of treatments. And I definitely have treated this and witnessed this, and it's a very difficult process. So as well as there's a greater need for invasive medical support. So there are gaps in the evidence base, of course, requiring further research, but also needed policy and practice. So these were some of the terms that were used, and one thing that I encourage budding researchers to pay attention to is what are the actual search terms that were used to try to determine a very comprehensive sort of search on antimicrobial resistance. And so what is actually really neat about this is that number one, I just lectured on EndNote. So EndNote is a reference citation manager. So This actually is the specific search protocol, search terms, which is rare for you to find. Pay attention to the ampersand, pay attention to the asterisk, where those are. Asterisks are usually placed where there's uncertainty as to what the ending should be in that term. So this is a good search protocol to be paying attention to if you're just learning how to conduct a literature search. So definitely this is one of the classic ways to create a Prisma diagram. If you're not familiar with this, eh, definitely in medicine you'll see this. Typically you start off with identifying a large number of articles, and in this case this was about 11,000. Then you screen. Um, they were screened, and only 100 were remaining, so that's what's there. Um, when you're thinking about surgery, of course, antimicrobial resistance, organ transplantation, cancer, patients in the ICU, diabetes, infant and pediatric patients, immunodeficiencies, liver and kidney disease, physical trauma. Um, Go over these. These are actually good subtopics, which allows you to then relate antimicrobial resistance to these concepts. Um, they categorize and subcategorize these, so it's good to go over some of these so that there's ideas for connections for chronic diseases. If you want more information on antimicrobial resistance, and I'll continue to make videos on this, of course, because it's such a broad topic, very difficult to cover in one small clip. But if you would like more information, go through the references section. I'll point out maybe the top 3 you should visit. I wish I could actually visit the websites, but I don't want to make this more than about 10 minutes. So here you have World Health Organization always has a really good place for antimicrobial resistance. Um, Typically, I trust Europa. That's typically the European kind of mandates on antimicrobial resistance. Um, I've used this for environmental health, so this is something that might be one to look at. So I've provided you with 2 wonderful resources to be looking through on here. And then definitely there are quite a few papers, 93 in fact, papers in here that you could be looking at. But the main ones that you want to start off by is um, looking at some of these websites where there's starting information. In fact, I would just click on the website and take a quick look at what's there. And so, see, there's more information and talking about the problem. And in fact, I would argue that there's uh, more antimicrobial resistance in some parts of Europe, um, in certain areas, especially sexually transmitted infections. I believe there's more there than than here yet than in the United States. But of course, that is changing very rapidly, and so there's a lot of different patterns to be looking for. So just bottom line is, this is another place where you can kind of branch off and take a look at some of the hospital healthcare acquired infections, because this is a part of antimicrobial resistance as well. but on a different note. So definitely not part of this. But different, definitely on the left. Quick, just I'm going to end with this. Antimicrobial consumption, antimicrobial resistance, hospital-acquired infections, immunization, vaccines, migrant and refugee health, and disease vectors. And then EU case definition. Let's take a look at these as well. Thank you for listening.